Hey guys, it's Matthew here from Hearing Tracker, keeping you up to date with all things hearing related. I imagine that you've arrived here after spending hours searching online for terms such as ringing or buzzing in the ears, or perhaps what causes tinnitus. Or maybe you've been to a doctor or physician and they've told you that there's nothing that can be done about the recent sound that you started hearing inside your head. Well, you'll be pleased to know that you've ended up in the right place, and this isn't the case at all. There is a huge amount that can be done to help you out with that new and unwanted annoying sound that you're hearing inside your head. On the Hearing Tracker channel, we cover a vast range of ear-related subject matter. And whilst there's a massive amount that I talk about when it comes to tech and how that can help with hearing, including with tinnitus, technology isn't always the only solution. In this video, I'm going to run through the main causes of tinnitus and the best well-researched methods that you can use to manage it, and also to potentially stop it from getting any worse. If you're keen on keeping up to date with the latest news in the hearing technology world, then make sure you subscribe to this channel, press that grey notifications bell, and you'll be updated every time we release a new video. Interestingly, if you search for tinnitus in Google Trends, which is a great tool that monitors how often people are searching for certain terms on Google, you'll realize that you are not alone when it comes to tinnitus. Not only is tinnitus often researched, but during the months of January and February, the search volume almost doubles that of the rest of the year. And this has been happening year on year since Google started their records. Having personally experienced tinnitus for as long as I can remember, this is a really important subject for me to discuss and share as much as I know with as many people as possible. So today, not only will I be talking about how I discuss tinnitus with my patients in clinic on a daily basis, but I'll also share a few of my own personal experiences too. My tinnitus experience may be the same as yours or completely different. We all have our own story. The first time that someone told me that the noise inside my head wasn't something that everyone experiences was about 14 years ago in an audiology lecture, specifically on tinnitus itself. Up until this point in my life, I genuinely thought that it was just my body working and doing something that the body does. A little bit like those times when your eyelid flickers or when you see those floaters that some people experience, including myself, floating around your eyes. My specific tinnitus is a high frequency tone at around about 14,000 Hertz, which if you have the volume on for this video and normal hearing sensitivity, you should be able to hear just now. It's the same in both ears, it's there all of the time, and I tend to notice it most often when I get into bed at night time and there's no surrounding sound. Or alternatively, if it's quiet during the course of the day, especially if I'm tired, stressed, or unwell. I find this last point super interesting as it shows that tinnitus isn't solely a sound being perceived in the ears which doesn't change. The fact that it changes and gets better or worse means that there aren't just physiological elements to tinnitus, but there's also a psychological element present too. Studies show that up to 15% of Americans suffer with tinnitus, which is a huge 50 million people. 20 million people struggle with burdensome chronic tinnitus, and 2 million have extreme and debilitating cases. Over in the UK, the figures are around the same, with roughly 1 in 8 people experiencing tinnitus, and of those 1 in 8, 1 in 10 report that it has a significant impact on their day-to-day life. Tinnitus is most common in those with hearing loss, however it can also be found in those with normal hearing too. It is possible that tinnitus can be both temporary or permanent, and I'll run through the most common causes of both of these with you now to see if any of this sounds familiar. So first of all, temporary causes can include exposure to loud sounds such as going to concerts, listening to loud music, shooting, or working in a particularly noisy environment. You've probably all experienced the feeling when your ears are a little bit blocked and there's a ringing in your ears after a loud night out. This drop in hearing is known as a temporary threshold shift. And believe it or not, the shift is actually measurable with a hearing test. It's not just a perception of a drop in hearing. The resulting deterioration of hearing can last anything from 24 hours up to a whole week, depending on both the duration and the intensity of the noise exposure. As our ears are incredible things, they can recover from this exposure to loud sounds and bring hearing levels back up to normal. However, with continual and multiple times of this degree of exposure, this can give potential for both a permanent hearing loss and also permanent tinnitus. Therefore, whilst I've advised that this is a temporary cause of tinnitus, if the exposure to loud sounds is ongoing, then it can become permanent. If you've ever had an ear infection, then you'll possibly also be aware that they can be a major cause of tinnitus too. You may have heard of them referred to as otitis media, otitis externa, or even glue ear. They can also cause hearing loss and do require immediate attention from a doctor. One tricky thing with an ear infection is that one assumes that it's likely that you'll experience pain, which isn't always the case. A perforated or ruptured eardrum can be caused in a variety of different ways, including ear infections, sudden changes in pressure from activities such as flying or scuba diving, physical trauma such as a blow to the ear, or using Q-tips to try and clean your ears, which, by the way, I wouldn't recommend. Even sudden exposure to loud sounds such as an explosion can cause your eardrum to rupture, all of which again can cause tinnitus. Another very commonly reported problem causing tinnitus is a buildup of earwax. This is a nice, easy fix and requires a visit to an audiologist to have the wax removed. This can be done either using microsuction, irrigation, or mechanically using a variety of tools. Once the wax is removed, you should experience immediate relief from your tinnitus. And one final cause of temporary tinnitus can be stress and anxiety, of which it isn't always obvious if your tinnitus is caused by stress anxiety or actually exacerbated by both of those factors. I'll talk later on in the video about coping mechanisms for this type of tinnitus. In terms of common permanent causes of tinnitus, this list has the potential to be absolutely huge. So I've shortened it down to the 6 most common. Firstly, a sensorineural hearing loss, which affects the nerve of hearing or the cochlea. When I say sensorineural hearing loss, not only do I mean presbycusis, which is the medical term for an age-related hearing loss that gradually develops over a period of years, but tinnitus can also present itself with a sudden sensorineural hearing loss, known as SSHL, which can develop in less than 24 hours. Alternatively, there are types of hearing loss that affect the middle ear or the mechanical part of the auditory system, such as a condition called otosclerosis. This is a condition when the bones, also known as the ossicles, in the middle ear can fuse together very slowly over a period of time and reduce the transmission of sound from the eardrum to the cochlea. Whilst this condition is rare, it is far more common in females than males and is often identified when there is a family history of the condition. Whilst many people associate Meniere's disease with a loss of balance, dizziness and nausea, there are often symptoms including hearing loss and tinnitus which coincide with attacks of the condition. The condition mainly affects those between their 20s and 30s, and there are a few different methods to help with the reduction of tinnitus, which again I'll come to later in this video. The leading cause of traumatic brain injury, or TBI, in civilians are motor vehicle accidents, falls and assaults. These can result in head trauma or neck trauma in the form of whiplash. In military, servicemen and women, blasts from an explosion are the leading cause of traumatic brain injury. Injuries of this kind can affect both ears or a single ear. Many patients who have experienced head trauma may only suffer with tinnitus symptoms for a temporary period of time. However, the effects can also be long-term. It is possible that certain medications and chemotherapies are known to stimulate the onset of tinnitus. Many of these drugs are only given for serious illnesses where there is really no other alternative. However, there are also a few more commonly prescribed medications that you may be surprised about. I will say that if you're concerned that you may fall into this bracket, then it's worth a conversation with your doctor who prescribes your current medications, rather than adjusting your own medications without seeking their advice. Certain drugs that can cause tinnitus are aspirin, quinine, certain antibiotics, and chemotherapies and diuretics. An acoustic neuroma, also known as a vestibular schwannoma, is a rare, non-cancerous, slow-growing tumour which is found on the 8th nerve, which is the nerve responsible for hearing and balance. These tumours can be found in both men and women and are most common in those between the age of 40 and 50, with hearing loss, tinnitus and dizziness being the most commonly reported symptoms of those with an acoustic neuroma. All of these conditions essentially result in less information being sent from the ear to the brain. And one common interpretation of tinnitus is that as there is less information being passed from the ear to the brain, and the brain is used to receiving certain levels of information, then it tries to fill the gaps, and in doing so gives us the perception of tinnitus. So, the big question and the main reason that you're all here is, what can I do to overcome my tinnitus? Here is a list of 4 things that you can do to help. First of all, if you haven't yet had a hearing test, then the first thing that you need to do after watching this video is get yourself in with an audiologist. They will be able to thoroughly examine your ears, test your hearing, and identify if you have any form of hearing loss. As a minimum, you want to ensure that they perform otoscopy, tympanometry, and pure tone audiometry. Not only will this help to identify whether or not you have a hearing loss, but if there is a deterioration of hearing present, then this test battery will also help to be able to identify where the hearing loss is originating from. If they identify any temporary causes of hearing loss, such as the ones that we discussed earlier in this video, then this should be able to help or refer accordingly to rectify the issue which is causing your tinnitus. Alternatively, if it is a permanent cause of hearing loss, such as an age-related hearing loss, for example, then the best thing that you can do is to begin to wear hearing aids. Now, if you're not somebody that wears hearing aids already, just so that you know, hearing aids are not the big, ghastly things that you now are thinking about inside your head. Check out some of our independent tech reviews, which I'll link in the description to this video, for an idea of the technology that's around nowadays, how they look, and exactly what they can do, which I promise you will blow your mind. By managing your hearing loss, this will then fill the void that I was talking about earlier with sound. A survey of healthcare professionals in 2007 found that respondents self-reported that roughly 60% of their tinnitus patients experienced at least some relief when wearing hearing aids, with roughly 22% of patients reporting a significant relief from their tinnitus. Sound enrichment therapy can provide you with a temporary relief from your tinnitus by playing another sound on top of your tinnitus to hide and mask the sound of your tinnitus, to distract you from it. This can be anything from playing music in the background when you're trying to sleep, which is something that I used to do in the past, to having a fan blowing in the background. There are even a few great videos here on YouTube with various white noises to choose from, which I recommend to patients in clinic too on a daily basis, who do benefit from this type of relief. This is also another area in which hearing aids can significantly help, not just by providing the gain necessary to compensate for a hearing loss, but each hearing aid manufacturer also has its own tinnitus features built in order to provide some degree of sound enrichment therapy. The user can have either dedicated programs providing these masking sounds, or the sounds can be overlaid in a main program if your tinnitus is particularly overwhelming one day. You would normally work with your audiologist to find the most appropriate masking sounds that help you to overcome your specific tinnitus. And it's possible to choose from a variety of different noises, for example, pink or white noises, and there are even nature sounds such as ocean waves, which I personally find a little bit more relaxing, that you can choose from. I'll play a couple of very brief examples for a few seconds each now, and it'll be interesting to see if you get any momentary relief. As I discussed earlier, 50% of tinnitus is physiological and caused by some physical damage, and the other 50% is psychological. More often than not, though, it isn't possible to do anything to resolve the physiological damage, as whatever the physical cause of tinnitus is, it's there and it's there to stay. That doesn't mean that it's anything to be worried or concerned about, and most of the time it's non-life-threatening. However, we can do something to look at managing the psychological element. After all, it makes sense, doesn't it? Why else would it be possible for the tinnitus to get louder if we're tired, stressed, or anxious? There's nothing physiological happening there. It's all in one's head. So the big question is, how can we help ourselves to get over it? It's really about changing our brain's emotional response to the tinnitus, using either CBT or mindfulness, or a combination of the two, and not generating negative emotional feelings towards it, which, yes, is easier said than done. Otherwise, you're in a never-ending cycle, as if your tinnitus is made worse by stress and anxiety, then when you hear your tinnitus, you'll become more anxious and more stressed. And when you become more anxious and stressed, you'll hear your tinnitus more. which is never ending and will just simply go on and go round in circles. So this is where CBT and mindfulness comes in, with the aim to get you out of that never-ending cycle. Research shows that whilst maskers can help to provide momentary relief, the most effective form of relief from tinnitus is to undergo some form of CBT or mindfulness. Another thing that I find is massive in terms of helping people with their tinnitus is as simple as awareness and understanding. There are a huge number of patients that come through our practice and don't always need ongoing support in the form of hearing aids, sound enrichment therapy, or CBT and mindfulness. They often just need a little support and the knowledge that their tinnitus isn't anything sinister or a sign of anything life-threatening. This could well be you today, and I hope that with the information in this video, you'll feel a little bit more relief that you're definitely not alone and have a better understanding of some of the steps that you can take to overcome your tinnitus, or even who you can seek out to help you. So, whilst we have no known cure for tinnitus, there are a lot of tried and tested methods out there which will help to reduce the daily impact of your tinnitus and help you on a daily basis. And they work. The challenge is that if you're after a quick fix, I'm afraid you're not going to get it. This does require time and patience, which I get it. When you're experiencing a bad day of tinnitus, the last thing that you want is someone on YouTube telling you that you have to be patient with it. Now, there are also a few types of tinnitus that do require immediate medical investigation. First of all, pulsatile tinnitus, or tinnitus that follows your heartbeat. Secondly, tinnitus if it presents itself in one ear. Thirdly, if the tinnitus has changed in nature significantly over a very short period of time. And finally, if the tinnitus is causing you to not be able to sleep or contributing to anxiety or depression. If you do fall under any of these categories, then it's best for you to head over to your doctor and they should refer you for further investigation. Also, on that note, if you develop a sudden sensory neural hearing loss, either with or without tinnitus, then you definitely need to get yourself over to the emergency room or an urgent care ENT clinic as soon as possible to investigate the cause of that hearing loss, and hopefully for treatment as soon as possible. I do hope that you found this video useful, guys. If you like this video, then please hit the like button. If you have any questions, then drop them in the comments below. And if you haven't subscribed yet, then make sure you do so. I'll see you in the next video.